You have Medicare. You did everything right, and you still can't get the care that you actually need. Medicare is real coverage, real care, and it handles hospitalizations, real emergencies, chronic conditions, and it does its job. Specialty visits, so much of Medicare is helpful. But there's a gap that most people don't talk about. It's wellness care, it's medication management, it's getting healthy and being able to live a thriving lifestyle. It's shifting your eating habits and movement and exercise and enjoying life. Medicare doesn't cover that. It likes to say it does, but then when you go to the doctor and you ask for that kind of care, they can't give it to you. In this video, I'm going to talk about what are some of the things that you can get from Medicare and the things that you can use it for. And I'm going to talk about how you can get those other things that help with lifestyle, medication management, taking care of yourself so you can enjoy living life in your senior years. What Medicare actually covers. Medicare covers hospitalizations, emergencies, chronic conditions, all those things. It does not cover lifestyle medicine, nutrition, taking care of yourself in a way that's going to give you a quality of life. It doesn't have the capacity. So, how does this work? Medicare is in the same traditional insurance system that I've talked about in previous videos. It's no different. It actually has more regulations because it's under Medicare. So, what happens is you get 10 to 15-minute appointments with your doctor. They look at labs, specific labs that they're only allowed to run. They can only run certain ones, look at your medications, and you're on your way. They're not addressing root cause or finding ways that you can actually get better, have a higher quality of life. They're taking care of problems that come up and symptoms that you have. I'm going to give you an example. Maybe you go in for chronic pain. You're like, my back's been hurting. And so you go to your doctor, and guess what? They might do some x rays, they might do an MRI, even if it's a big deal. They might do a CAT scan. They might do all of these diagnostic things, and they're still going to prescribe you an anti inflammatory. That's it. And they're going to say, okay, now do the anti inflammatory and then come back and check in with me in 6 weeks or 2 weeks or whatever the time frame is. And you go back, your back still hurts. They haven't talked to you about physical therapy. They haven't talked to you about a chiropractic. They haven't talked to you about acupuncture. They haven't talked to you about what you're eating and possible electrolyte imbalances that are causing pain in your muscles. They don't talk about how much you're moving, none of that. They look at diagnostic, lab, x-rays, MRI, and it's a coded situation. So let me dive into that a little bit more. The chronic pain issue, the anti-inflammatories, those are all coded. So what that means is in the system, they type in a specific medical code, and that's what comes up, and it shows what medications they have to pick from based on that code. So there's different anti-inflammatories, different levels of pain management. You have opioids, you have just basic anti-inflammatories. Like you have all these different levels, but they're in codes. So whatever they diagnose you with gets assigned to that code. That's how it works. And if you don't fit in the code, they can't help you. If they don't have a code for it, they can't help you. If you aren't showing the right symptoms for them to look at something else outside of the code, they can't help you. So this is something to keep in mind when you're using your Medicare. I'm not saying don't use it. I'm saying it's limited to what it is capable of doing. So use it to the capacity that it is able to help you. But if you're not getting the help that you need and things aren't changing for you, it's time to look at a different option. Here's what most people don't realize. You don't have to choose between Medicare and cash-based. You can apply both. Medicare handles what it's good at: emergencies, hospitalizations, medication specialists. If you need to go see a specialist, you can get covered under that. Cash based covers what Medicare doesn't. So if you aren't getting what you need, it's time to look into a cash based practitioner that can work outside of the system. They can run different labs. They can look at things differently. You can look at your nutrition, your lifestyle, movement, exercise, flexibility, energy medicine, acupuncture, massage, chiropractic, all those things fall under cash based and they fall outside of the system. I'm going to give you exactly what a person that I know is doing to utilize both of these a little bit later in this video. But for now, let's talk about cash based. Cash based practitioners are not bound by billing codes. They don't have to worry about that. And they'll tell you upfront how much something is going to cost. So when you go in to talk to a cash based practitioner, you're going to walk in and get an assessment, and then they'll tell you, here's how much it's going to cost for what I see you are required to do with me as your practitioner. Here's the plan. Everything is laid out, and it's laid out by what the expectations are and how much it costs. So you can budget for what you need. A lot of people think that concierge medicine, that's a term that's going around, is for wealthy people. That is not true. That is not the case. That is something that people say, and it's a belief that they have. And there are higher cost concierge medicine, depending, a lot of this depends on location of where you live, what type of service you're looking for, and how much time and the choice of what you're doing. So what is it that they're helping you with is going to determine the price as well. But for basic wellness care, it is extremely reasonable in price. So what I want to do is let's look at the numbers. So in this next section, I'm going to talk about the numbers. These are numbers that came up when I did research for 2026. So let's get into what some of these numbers look like. So first of all, I want you to think about, what are you currently paying for your supplemental Medicare and out-of-pocket expenses? So get that number, add that number up, because that is money that you're paying extra. So you can see how much that is. I know there's different levels of Medicare. So if you're paying for extra care in your Medicare plan, look and see what's covered under that. It may be that you need to switch it to just the minimal that covers what you need for Medicare. And then those supplemental things that are extra that cost you out of your pocket, you can just take those out. And then that's money that can go towards cash based. Next, I'm going to talk to you about what cash based looks like from the numbers perspective. Specialists, cardiologists, neurology, diagnostic services that are like that, they are covered by Medicare because they are diagnostic services. Diagnostic is within the system. That's why I said with the chronic pain at the beginning, that's a diagnosis that they're giving you a code that matches the system. So those specialty services are going to be covered by Medicare. And I'm going to use one of these in the example that I share later in the video of a real live person that's working through this. So let's get into the gap. So what's missing? If your specialists are covered and your basic care for emergencies, hospitalizations, and medications, that stuff is covered under Medicare. What's happening in the gap? Based on 2026, these are the numbers, and I'm going to be looking at my notes. So if you see me look away, that's what I'm doing. I'm making sure that I'm getting these accurate for you, because I did do this research, and basically for wellness care, this is going to be your everyday. What am I doing every day to be healthy, to take care of myself? And medication management is in there because it could be that you have medications that your Medicare primary care doctor is providing you that you may not need if you change your lifestyle. And this is something I'm going to get into with the example later in the video. So stay tuned to that. If any of this has been helpful for you, please subscribe to the channel. It helps the channel to grow and get out to other people. Share the channel. If this message resonated with you, and like I know like 5 people who need to hear this message, share the channel with them, because the more that we share, the word gets out and we get more awareness around this topic. So Medicare's helping you with certain things, and now you're like, I think I want to check out cash based. A single primary care visit without insurance averages $160 to $171. A new patient can run from $200 to $400, depending. I'll have those sources down in the description for you. Direct primary care membership, and this includes unlimited visits, longer appointments, a direct relationship with one provider, that averages from $50 to $100 a month. And this is a monthly membership. So you get unlimited visits, but you pay monthly the $50 to $100. Concierge medicine is a little bit higher because it's usually more specialized and it might be harder to find in your location. So depending on where you live, it could be a little bit higher. It averages $167 to $417 a month. All of these costs that I'm telling you, they're all depending on the practitioner. So I'm just curious, how many of you that are watching this video, comment below if you have used cash-based practitioners for other things, chiropractic, acupuncture, massage, all those things outside of what you're getting with your Medicare. I'm just curious to know who's already using these things. And if you aren't and you have a question about it, put that in the comments and I'll answer those as well. So with these costs, this is all out of pocket. So it gives you the monthly you can actually budget for. So it's similar to when you have your supplemental for Medicare. If you're paying extra already, but you're not getting what you need, you can drop the supplemental on Medicare, do basic Medicare, and then take that money and put it into a monthly membership with a cash-based practitioner if you want to do that. And then you're covered for everything. Hospitalizations, emergencies, all that's under Medicare, specialists. And then over here, with the cash-based, you're covered for all your lifestyle medicine and things that you are doing for overall wellness to keep you healthy. And what might happen is you may get off some of those medications. If you're doing nutrition, say you're paying for somebody to help you with your nutrition and you're shifting your nutrition and you're shifting your mobility to a place where you don't need some of those medications anymore. So it depends. They work together. So for most people to fill that gap, it takes a little bit of understanding what you're already doing. What are you already paying for? And taking that and deciding, what can I afford to do outside? And what are some of the things that are missing? And this is a conversation you can have with your Medicare provider. The next time you go see your primary care provider through Medicare, ask them. Say, this is what I would like. I'm moving towards this goal. Can you help me with that? How can you help me with that? And see where there's gaps. See where they're missing what you need. And if there's stuff missing, then that tells you I need to go over and find a cash-based. How do you find a cash-based? The Centered Care Directory. I created a Centered Care Directory. Centered meaning it is around patient-centered care, human-centered care, holistic-centered care. The word centered it's because it is focused on you. You go in and you can find a practitioner of any type of specialty. So maybe you go to your Medicare provider and you want to do acupuncture and they're like, we don't cover that. You can go over and search acupuncture and find a practitioner that does that in your area. So you can search by specialty and you can search by location and you can search by the name of the person. I know that was a lot of information that I gave you up front. As I promised, I'm going to give you a real live example. So this is going to give you a real live example of a person, a dear friend of mine who I know, and she called me one day and we were having a conversation and she's like, I just had my visit with my Medicare primary care provider. She's in Medicare. And she's like, Susie, it was horrible. He wouldn't listen to me. I was asking him about labs that I wanted specifically to look at certain things. And he said no. He was telling me just the medication list that I already had. And she said, I'm changing how I'm eating and what I'm doing. So my medications are shifting. And I was asking him about that. And he was just disregarding me the whole time. The appointment was only 15 minutes long. And he didn't answer any of the questions that I asked. I'm frustrated. She goes, I need to find somebody who will listen to me. She's on Medicare and she has a cardiologist. So she does see an outside specialist cardiologist who does listen to her. Her cardiologist, she said, is amazing. He does review her medications with her and asks her questions of how she's doing. and has even taken her off of some of her medications through his services as a cardiologist. And she appreciates that. The primary care, though, on the other hand, just wanted to keep going with the medications and basically said, we're going to run your labs in another 2 months and then come back and we'll check you again. She's like, I'm not doing that. I'm going to find somebody that's cash based to be able to manage my medications. There are functional medicine doctors, board certified physicians who are cash based, who understand all the medications, all the labs, all the diagnostic tools. They've worked in hospitals, in surgeries, in ERs. They have all the knowledge. They just don't run under the insurance or Medicare system. Those are available. And she knows that. And she's like, Susie, can you help me? She's in Arizona. And I said, have you looked in the Center Care Directory? And she's like, I'm going to do that. So she actually is doing some research. She's finding the right practitioner for her. Long story short, she's using her Medicare. She's using it with what works for her. She's using it for her cardiologist, and she's keeping a primary care doctor through Medicare because you're required to have one to be referred to specialists. So if you needed to see neurology, cardiology, any of the extra specialties, you have your primary care to refer you within the Medicare system. But to fill the gap, she's changing her nutrition. She's working with a functional nutritionist. So she's been doing cash based with a functional nutritionist to learn what foods, and again, running labs. So the functional nutritionist is reading her labs and reviewing them with her and helping her to figure out how to adjust her eating, her nutrition, which also adjusts her medications. And because the functional nutritionist is not board certified to manage medications, prescriptions, she's going to get a functional medicine doctor, someone who can manage her medications as well, someone who will listen, someone who will take all the things that she's doing into consideration when telling her, okay, here's the plan moving forward. That's a real life example. This is a person who's taking responsibility of her healthcare, and she didn't just listen to the primary care Medicare doctor who's saying, nope, we're just going to keep you on the medications and just keep moving forward, and didn't even answer her questions. She's actually researching and finding, using the Center Care Directory, finding a doctor that's going to actually listen to her and work with her the way that she wants to improve in her healthcare. And she's 70. I love her so much. She's like, Susie, you use my story. You tell people this is what's happening. And it's happening to millions of people. There are millions of people across the country that are in this bracket of Medicare, and they're not getting the care they need. They're not being taken care of the way they want to live. I also have a 70 plus doctor in the Center Care Directory. He's been a doctor for 40 years, and he's functional medicine and cash only, and he's helping thousands of people. So there are plenty to find that can help you if you're in that place where you feel disregarded, not listened to, your questions aren't being answered, and you're paying for Medicare. If you're paying for supplemental, I would say if you're not getting the care you need, you definitely need to look at that. When there's open enrollment, look and see what you're paying out of pocket and take that away and put it into an account that you can use to go pay for somebody else that's actually going to help you. That's the trouble that we're in right now. If any of this has been helpful for you, please subscribe to the channel. It helps the channel to grow and get out to other people. Share the channel. If this message resonated with you, and like I know like 5 people who need to hear this message, share the channel with them, because the more that we share, the word gets out and we get more awareness around this topic. So I know that it's a big topic for people. I know that there are people out there struggling. They're not getting what they need under insurance, Medicare, and other system-based healthcare. And the Centered Care Directory is here to support you, for you to find who's going to help you. Before I go, drop in the comments if this was helpful for you. When you comment on the videos, it helps the video get seen by more people. YouTube shows the video to more people when there are comments. So please comment if this has been helpful for you. Even a simple statement of how it was helpful for you helps move the channel along, so more people can see, more people can be aware, and we can start helping each other get the healthcare that we need. I'll see you in the next video.